What if your body was quietly warning you that your heart is in danger, but you didn't recognize the signs? Most people believe heart problems always come with crushing chest pain or dramatic warning signals, but the truth is far more unsettling. Many cases of heart damage creep in silently, disguised as everyday issues we often ignore, like swollen gums, fatigue, or even snoring. In this video, we'll uncover 12 unusual signs that could point to hidden damage in your heart. Knowing these signals could save your life, because when caught early, heart disease is preventable and treatable. Stick with me until the very end, because I'll also share simple but powerful lifestyle changes that can protect your heart before it's too late. Sign 1. Calf swelling or pain. At first glance, calf pain or swelling might look like something minor. Maybe you walked too far, worked out too hard, or stood on your feet all day. But what many people don't realize is that it can be an early warning of peripheral artery disease, PAD, a serious condition linked directly to heart damage. PAD happens when the arteries in your legs become narrowed or blocked by fatty plaque, reducing blood flow. When circulation drops, your muscles, especially in the calves, don't get enough oxygen. This can lead to aching, cramping, or swelling that shows up most often when you're walking, climbing stairs, or even just standing for long periods. Some describe it as a Charlie horse that never fully goes away. What makes PAD especially dangerous is that it isn't just about your legs. It's often a mirror of what's happening inside your heart's arteries. If the blood vessels in your legs are clogged, chances are the vessels near your heart are too, raising your risk for heart attack and stroke. Other signs of PAD include coldness in one leg compared to the other, slower healing of cuts or sores on your feet, shiny or discolored skin on the legs, weak or absent pulse in the ankles. Ignoring these signs can have serious consequences. Advanced PAD can lead to critical limb ischemia, where circulation becomes so poor that tissue starts to die. But catching it early can be life-saving. What you can do: see a doctor right away if you notice persistent calf pain or swelling. They may order an ankle brachial index test to check blood flow. Lifestyle changes like quitting smoking, eating a heart-healthy diet, and staying physically active can dramatically improve circulation. In some cases, medications or procedures may be needed to open up blocked arteries and restore blood flow. Think of calf pain not just as a leg issue. It could be your body's early alarm system, warning you that your heart is under strain. Sign 2. Erectile dysfunction. Most men see erectile dysfunction as an uncomfortable or even embarrassing topic, but few realize it can also be an early warning sign of hidden heart disease. In fact, doctors often call ED the body's check engine light for cardiovascular problems. Here's why. An erection depends on good blood flow. When the arteries are healthy and open, blood can circulate freely to the sexual organs. But if the arteries are narrowed, stiffened, or clogged with plaque, blood flow weakens, and ED becomes more frequent. What's especially alarming is that these same clogged arteries are usually affecting the heart at the same time. Studies have shown that men with erectile dysfunction are at a much higher risk of developing heart disease within 5 years. In many cases, ED appears before any chest pain, shortness of breath, or other obvious heart symptoms. That's because the blood vessels in the penis are smaller and get blocked earlier than the larger arteries leading to the heart. It's not only about circulation. Other heart-related issues like high blood pressure, diabetes, high cholesterol, and obesity all increase the risk of erectile dysfunction. Even stress and poor sleep, which put pressure on the cardiovascular system, can make ED worse. Other signs that ED might be linked to your heart include difficulty maintaining an erection despite normal sexual desire, ED developing suddenly rather than gradually, ED paired with other risk factors like high blood pressure or diabetes. Ignoring ED as just part of aging can be dangerous. By brushing it off, many men miss the chance to catch heart disease in its earliest stage. What you can do: see your doctor. Don't be embarrassed. ED could save your life if it reveals a heart problem early. Check your heart health. Your doctor may order blood pressure, cholesterol, or blood sugar tests. Lifestyle changes: regular exercise, weight management, quitting smoking, and limiting alcohol all help improve circulation. Stress management: high levels of stress and anxiety can worsen ED and strain your heart. Remember, erectile dysfunction is not just about sexual health. It's a red flag from your cardiovascular system that should never be ignored. Addressing it early could prevent a much more serious outcome, like a heart attack. Sign 3. Bleeding gums. A little blood when brushing your teeth might not seem like a big deal, but your mouth could be sending a warning about your heart. Persistent gum disease causes inflammation, and the bacteria from infected gums can enter your bloodstream, damaging arteries and increasing the risk of heart disease. Good dental care isn't just about protecting your smile, it's also about protecting your heart. Sign 4. Snoring or sleep apnea. Snoring might make you the butt of a joke at night, but if it's linked with sleep apnea, the danger is real. Sleep apnea causes pauses in breathing, lowering oxygen levels and straining your heart. Over time, this raises the risk of high blood pressure, arrhythmias, and even heart failure. If your partner notices gaps in your breathing or heavy snoring, it's time to get checked. Sign 5. Sudden extreme weakness. We all get tired, but this is different. Imagine an overwhelming wave of weakness that hits out of nowhere. This can be a sign of a heart attack, as the heart fails to pump enough blood and oxygen to the body. When combined with chest discomfort or shortness of breath, it's a medical emergency. Don't wait, call for help immediately. Sign 6. Skin rashes or spots. Your skin can tell the story of your heart. Inflammatory conditions like psoriasis or eczema increase heart risk, and unexplained rashes or spots may point to circulation problems. When the heart struggles, blood flow is disrupted, and sometimes the evidence shows up right on your skin. Sign 7. Nausea or indigestion. This one often fools people. Many heart attack victims first complain of what feels like bad indigestion or stomach upset. Unlike normal digestive discomfort, these symptoms don't improve with antacids. If nausea or stomach pain appears alongside chest tightness or shortness of breath, it may be more than an upset stomach. It could be your heart. Sign 8. Persistent hoarseness. Losing your voice after a cold is normal, but if hoarseness lingers without reason, it could be linked to heart failure. When the heart struggles, fluid can build up in the lungs and irritate the vocal cords. A stubborn, hoarse voice, especially paired with fatigue or breathlessness, deserves medical attention. Sign 9. Fainting spells. Fainting or syncope happens when your brain doesn't get enough blood. While fainting can have many causes, sudden unexplained episodes can point to dangerous heart rhythm problems or blockages. If fainting is paired with chest discomfort or shortness of breath, consider it a serious red flag. Sign 10. Sudden sweating. Breaking into a sweat while exercising makes sense, but if you're drenched in sweat while sitting still, it could signal a heart attack. Excessive sweating is the body's reaction to the stress of a struggling heart. Combined with chest pain or nausea, this symptom should never be ignored. Sign 11. Anxiety that feels different. Everyone experiences worry from time to time. But sudden or severe anxiety, especially when paired with physical symptoms like palpitations or breathlessness, can point to hidden heart problems. The heart and mind are connected more deeply than most people realize, and anxiety can sometimes be the body's warning signal of cardiovascular trouble. Sign 12. Reduced exercise tolerance. Have you noticed you can't do what you once could? Climbing stairs leaves you gasping, or a short jog feels exhausting? A sudden drop in stamina may mean your heart isn't pumping efficiently. This is often one of the most important early warnings of heart disease, and one that many people dismiss until it's too late. The good news is, you are not powerless. Small daily choices can transform your heart health. Eat smart. Focus on fruits, vegetables, whole grains, and omega-3 rich fish. Cut down on saturated fats, sugar, and salt. Move more. Aim for at least 150 minutes of moderate activity each week. Check regularly. Monitor blood pressure, cholesterol, and blood sugar. Quit smoking and limit alcohol. These changes drastically reduce heart risks. Manage stress. Mindfulness, meditation, and simple breathing exercises can protect both mind and heart. Your heart is the engine of your life, and sometimes it whispers before it screams. By paying attention to these unusual signs, you may catch trouble early and give yourself the chance to live longer, healthier, and stronger.